Hi everyone, I'm Laurel Withy, and for my program evaluation, I chose Connections at Project Harmony. Connections is a program designed to help children aged kindergarten to fifth grade and their family members access mental health services. Connections works really hard to reduce any barriers families may have, so oftentimes people who are not English speaking will really struggle being able to find a therapist. There can be limited availability. A lot of times single parents cannot make the traditional 8 to 5 time frame work to attend sessions. And then oftentimes there's a lot of financial barriers in the way when it comes to accessing therapy, most of the time being related to insurance, high copays, high deductibles, and sometimes people just might not have a ride or could be able to afford child care for other children in the home while taking their kiddo to sessions. So those are all things Connections helps with and will financially cover the cost for to make therapy accessible for children. The duration of the program is usually about 12 to 20 sessions, and then they're in the program usually about a month longer than that of just waiting on the wait list and getting kind of that upfront paperwork and information done. And Connections utilizes evidence-based practice models, group and individual therapy models that I will dive into a little bit here. So this would not be at all possible without the program partners Connections heavily relies on. So all the schools listed here are the main referral source for Connections. Connections also utilizes community agencies such as the Learning Community Center of North Omaha and the Learning Community Center of South Omaha. Also in response to the COVID pandemic, Connections created a referral line, so parents are actually able to contact that number or email themselves and self-refer them into the program as well, which is something quite new for Connections. Before the pandemic, it was simply referrals through schools. And then Connections also makes it possible to serve all of these children and families by contracting with 90 therapists throughout the Omaha metro area, and they are always hoping to grow this number as well. In terms of recognizing the importance of helping families access therapy in our community, I think there was multiple factors playing in. So a huge piece was when Connections started in January of 2015. There was a lot of research coming out about how trauma impacts mental health and how trauma impacts the brain and the longevity of life in short-term and long-term outcomes. So that was something a lot of people in the mental health field were really starting to take seriously and try to create prevention efforts for. And then there was also just some community responses that we locally were experiencing in the Omaha or Nebraska area. So not sure if anyone remembers this, but in 2008, LB 157 passed, and that was a safe haven law that is usually for people who are able to leave a newborn baby, usually around 72 hours old to 30 days old, at a hospital without receiving any criminal charges. However, through this bill in Nebraska, there was no age restriction, and it left about 35 children that were older left in Nebraska hospitals. And after assessing why these parents had left those kiddos behind, most of the time it was because the family was down on their luck, feeling really overwhelmed, just weren't being helped or supported in the ways that they could have to help keep this family together. So just a really huge need again for mental health and support before families were a part of the juvenile justice or child welfare systems. So along with that, there was the amount of services that are available within the child welfare system and juvenile justice system. There's, mandated therapy or certain intervention models that the children must attend and be a part of. So people just saw kind of the counterproductiveness of having these intervention models or therapy provided and not before entering those systems. So kind of just with all of these dynamics at play, seeing the need globally and through mental health research, and then just in the own Omaha community, the Connections program began, and it is a short-term trauma-focused program with really an emphasis in prevention and hoping to prevent child welfare system entrance or juvenile justice system involvement. And then I did want to include the Connections release of information form. I think it really shows how many pieces of the puzzle are working together here to prevent a lot of issues related to mental health or families that are just really on the verge of maybe getting involved in juvenile justice or child welfare, but just need that support to prevent that. So we have here a mental health provider that will be involved, the school district that will be involved, and all of the further ongoing information about this kiddo, whether or not they entered the juvenile justice system, whether they fall victim to addiction with substance abuse, how they are doing with their Department of Education records and where they're at with those. Are they improving? Just a really big wraparound assessment of whether or not mental health intervention helped these kids and prevented them from entering these systems. So I thought this was really helpful in just conceptualizing all the ways that Connections hopes through mental health to improve the life of their clients. And as I already mentioned, Connections is a very new program established in January of 2015, and throughout the longevity of the program, the main funders have been the Sherwood Foundation and the Scott Family Foundation. Along the way, there has been some grants, the disaster relief from the flooding or just pandemic grants that have come up that Connections has been able to add more services through. However, the main funders are the two foundations, and I also included the Board of Directors and Service League Board of Directors who have done a lot of help with charitable donations as well to keep the Connections program running. So when it comes to evidence-based practices utilized, there is quite a scope of opportunities and evidence-based models that the Connections program is able to offer clients to utilize to best help with the mental health concerns. This is not to say that every single therapist Connections contracts with is certified to use all of these models. However, they are able to meet the client's needs by matching them intentionally with someone who may really benefit from play therapy or cognitive behavioral therapy. So utilizing the skills in our community and making those appropriate matches while being cognizant of the evidence-based practices that we can best offer families is really impactful in making a good match and getting kids the services they need to improve their mental health symptoms. So here is a continuation of the evidence-based practice models. The difference is with group therapy, however, is these are offered in the school, and the school counselor or social worker, will identify who would be the best fit. So kind of compared to the Connections program, deciding which therapist and evidence-based model the therapist practices. In this scenario, the school staff would identify who would best be served by the group being offered to the school that semester and create that group, and then the mental health coordinator would work with the family to get all the necessary paperwork and education made so the family has an understanding of the group model and how it would best serve the child in the school and in a group setting. So in this program, there are a lot of different social problems being addressed. I think when working with mental health and trauma, it is just a very complex issue that has a lot of barriers and issues in the society that we need to work to improve upon. So again, the main thing with Connections is hoping to prevent child protective services in the juvenile justice system. But how does the Connections program do that? They do that by working really hard in issues related to stigma for mental health. Connections reported just in the few years that they have been working that they have been able to see a huge decrease in accessing mental health services. However, they're always hoping to see that improve, and more people recognizing that going to a therapist is just like going to a doctor when you aren't feeling well. And then educating people about why accessing mental health can really help change their relationships, their health, their stress levels, just really understanding how that can best help the family with their outcomes and even longevity, like doing well in school or accessing a good job. Just those long-term benefits of therapy are not necessarily something everyone in our community has education or access to. So that is something that the Connections program hopes to educate the community more and more about. Another huge issue is there are not enough therapists in the community for children and families. 90 therapists sounds like a lot, but with the need in our community, it's not enough. And of course, that's why Connections is always hoping to contract with more therapists, but they also do a lot of work with trainings and consultations just to help build more and more therapists that also have more and more evidence-based practice models that they are trained in, just to help serve every child in the best way possible. And then again, another huge issue that we are hoping to address through the Connections program is finding a therapist that's in network. So a lot of people who have Medicaid have a really hard time finding a quality therapist. A lot of people aren't able to find a therapist that is willing to meet outside of the 8 to 5 time frame. It is really hard for people to find a bilingual therapist or someone who's willing to use an interpreter. So those are all huge barriers that prevent people in the Omaha community from being able to access mental health services. And those are all issues that Connections hopes through training, incentivizations, and education that they can help change or improve upon in the Omaha area. So since Connections is a program that primarily helps children access a mental health therapist, they would be considered a special needs population just because the population of children rely on their parent or guardian to help them get access to therapy. That's why informed consent in this program is very important. And not only is informed consent important, but parent engagement is a huge piece of helping kids improve their mental health symptoms. Having a supportive parent that supports the child's therapy goals and coping skills will really determine the success of the child in a lot of ways. So for cultural sensitivity for the Connections program, I think there was a lot of really positive things that I was shared with. So of the 90 therapists that are contracted with, they are therapists that are all across the Omaha metro area of all different backgrounds. They have quite a few bilingual therapists as well. And I think it's just really important to have therapists that are in clients' communities or neighborhoods where they feel most safe. And that they're able to meet within their own communities. As far as Connections itself as a staff, the program uses the culturally linguistic appropriate services training as the recommendations from that training for most of their policies. So what that looks like is, regardless of anyone's language that they use, that every single person is using a pre and post survey and pre and post test, because everyone's feedback matters regardless of language. Connections has done a lot of work to make their pre and post assessment tools in multiple languages, as well as their handouts. So those group models that were discussed, a lot of times there'll be a handout sent out for families that are in their preferred language. So currently Connections has handouts and assessments in English, Spanish, and then in Karen. Along with this, Connections has a very diverse staff. So they actually have 6 Spanish-speaking mental health coordinators that work directly with the family and 1 French-speaking mental health coordinator. So that is also really great for families to get to have a mental health coordinator that can directly speak with them. And then for mental health coordinators who are not able to directly speak to their clients, the Connections program utilizes some interpretation services, being the Language Line and Global Language Solutions. And since there's so many working parts in Connections, there are a lot of inputs. So of course we have the funders, the board of directors, and then executive leadership, along with connections leadership. So connections leadership is going to be, creating those contracts with all of our agencies that we work with or the therapists that we work with, creating the policies and procedures, applying for those grants. The mental health coordinators will be working hard to engage the family, connect the family to resources or barriers that they need help with, and helping them identify a therapist that will work best for them and their family, while working closely with the school staff to identify who would be a good match for connections, getting the family on board and engaged, and then just helping in the long term with engagement with the family as well. And then, of course, the therapist working hard with the families to create skills that will last throughout the lifetime. And so how schools do this is they will oftentimes identify a child who, after experiencing a trauma that has been reported to them by the child or the family, has noticed a change in behavior or has noticed a decline in school engagement or a decline in grades, and just thinks that mental health services would really help get this child back on track. So after receiving that referral, the connections staff, the mental health coordinator, will reach out to the family, explain a lot about how therapy works, how it can reduce symptoms, just kind of what the child is experiencing, that can be a trauma response. So a lot of times parents are just kind of at their wits' end with behavior, especially externalized behavior, and thinking it's their child being a bad kid. But once parents understand that trauma responses and big emotions to traumatic events is pretty common, and understanding how they can help the child, therapy starts clicking for how it's effective and how it can help the whole family. And then just at this time when we're also educating families about therapy, it's a good time to gather the therapist's preference, the family's preferences. So a family may feel much more comfortable with a therapist that speaks Spanish. A single mom may identify that she really wants a male therapist for her son because she wants him to have a positive male role model in his life. Things like that can be really impactful for gaining trust and building rapport with the families, and just really serving the child for their needs and who they would most feel comfortable, sharing some really hard things with. The therapist match is also identified, and just having a lot, again, of those considerations of who would be the best fit, expertise, race, languages that are spoken, things like that are all taken into consideration. And then the therapist can see the child in the home, in the school, in the community, or via telehealth. It's really up to the provider and the family of what works best and what's most appropriate for therapy intervention. And then as explained a little earlier, the group therapy models are implemented in the school, and they take place in the school. They're about 10 to 8 week programs. So throughout the fall and spring semester, there are usually connections therapy groups going on in the schools as well. And all that hard work is in hopes to see the outcomes. Here I have included in my logic model. So in the short term, once we have that therapist match, we would just want to start identifying where the service would best take place, and just getting families on board. Midterm, we would want to see that mental health interventions start helping the family, so them getting access to psychoeducation, coping skills, strength identification, hopefully through therapy intervention. Family and school is seeing improved behaviors, improved relationships, improved communication, better grades, just since the mental health symptom intensity has reduced. We're hoping kiddos are kind of starting to bounce back. And then the long-term goals that would want to be seen in connections is just improved family functioning and dynamic within the family, just a stronger relationship, and perhaps a different way to go about stressful scenarios in the home, reduced fighting, improved communication, a long-term improvement in academic performance, hopefully more and more children going into trades or college or just doing better than how they were academically before the Connections program. And then again, just preventing child welfare, juvenile justice involvement, preventing substance use, reducing mental health symptoms, of course, throughout the longevity of someone's life. Them also understanding that there's no problem of going back to therapy, which I think is just really achieved through that reduced stigma, which is more likely to happen once someone has experienced therapy and realized that a lot of the stigmas or misconceptions are very untrue and that there really is no reason to judge someone for seeking mental health services. In terms of worth of the investment of the Connections program, at this time, this is a little hard to prove. So, of course, since this program has only existed for about 5-6 years, it's kind of hard to tell if children will have avoided the juvenile justice system or the child welfare system until they, of course, are 18 years of age. But in terms of short-term reports, which I will get into a little bit more through the evaluation process. However, in terms of the school and family perception, Connections has received a lot of really positive feedback, huge changes in behaviors, just really helped children and families as a whole turn their lives around and overcome just some really hard traumas, such as grief, loss, domestic violence, just mental health issues, parent substance abuse, a lot of those really hard and traumatic ACE scores, giving family the help they need, and hopefully doing some good long-term prevention. The Connections program will just need to wait probably until being about a 10 to 15-year-old program to know longevity-wise how much money society has saved from this program existing. In terms of the Connections program assessing for client satisfaction, I believe they assess in qualitative and quantitative measures. So there is a first session check-in, a midpoint check-in, and an end of services check-in, where the mental health coordinator calls or texts, whatever the family prefers, and asks if therapy is going well, are they feeling heard, are their needs being met, questions like that. And of course, also, are there any barriers that have come up that would prevent you from attending therapy? So gaining some good qualitative information that way. And then also at the end of the program, once they've successfully completed therapy, a Connections survey will be sent, asking more of those type of questions about how therapy went and whether it was effective and they saw a change in behavior with their children, but in a more quantitative way, so we can gather statistics and see the normalities throughout the program and everyone who completes the survey. And then there also is a closing letter, which offers the family to call or email to provide any feedback they would like about how their experience was within the Connections program. When considering a cost-benefit analysis for the Connections program, I think of the ACE study and just how those when an adverse childhood experience occurs, there's usually disrupted development, which oftentimes leads to PTSD symptoms and just like social problems, issues in school, which carries on to struggling to get a job, struggling to access medical care, struggling, are more likely to experience substance use. So I think the Connections program really works to meet families right away when the trauma has occurred and reduce those symptoms and help prevent a ton of long-term health issues that are associated with trauma. So just that alone, I think, is worth the investment. I think also the improved academic performance would be worth it in the long run, considering people within higher education are able to get better jobs and there's less social program help that the person may need. Reducing those externalized behaviors, or helping children reduce what could be diagnosed as oppositional defiance disorder or become a conduct disorder, could lead to violent crimes happening in the community. And when we're working to treat those problems and help children learn to express their behaviors in different ways early on and right away when these behaviors are happening, I think we could associate this to preventing future crime or juvenile justice involvement. So again, the research is not exactly there, just with how new this program is, but just seeing the firsthand results and knowing the data, I think when considering the cost-benefit analysis of this program, the investment will absolutely be worth it for the Omaha community. So Connections does a great job assessing whether or not the family perceived therapy intervention itself to be effective for the child. So every family does the protective factors survey that assesses the family as a whole and sees if the family has improved in their dynamic and functioning. While the Strength and Difficulties questionnaire is most likely used for individual therapy kids with adjustment disorders, anxiety, depression. Meanwhile, the child PTSD symptom scale would of course be used for more anxiety or PTSD related concerns and measuring at the beginning and at the end of services whether very common mental health concerns have been reduced or the intensity of them have been reduced. And then Connections also has a closed survey for group and individual, just asking whether they found the program to be effective and helpful and kept them educated along the way of where their child was at, what they were learning, and what their therapy progress is. So a lot of self-reporting data is what Connections relies on for assessing whether or not mental health concerns have been helped or reduced. So while Connections does not have as much long-term success data as they would like, they did offer me some short-term and midterm successes. So the average client takes 30 to 40 days from referral to match with a therapist. So they really aren't waiting too long on the wait list. From the referral from the schools, about 70% of families engage, go forward with the Connections program and utilize therapy services through Connections. And then of the families that are engaged and participating in therapy, there is an 82% therapy session attendance rate. So the Connections program also knows that a high percentage of their clients are regularly attending their therapy sessions. And then the Connections program is able to gather a lot of data from the therapist as well. So from those surveys that families complete, Connections gets a lot of good data about the provider and just attendance and whether or not they're considered effective. So that can be a good way to score therapists and whether or not Connections program wants to continue contracting with them. And then through a survey with therapists found 98% of therapists found that the match with the client and the therapist that a mental health coordinator works pretty hard on, they found that it was appropriate and that it was a good match and that the therapist felt well equipped to do a great job serving the client and family. And then through reports from the school districts, behavior has improved and test scores have improved as well. So those are all some great short and midterm data of how the program has successfully helped children and families. With the huge amount of evidence-based therapy intervention models that are utilized within this program, there is a lot of work on Connections' end to ensure adherence to the models or ensure fidelity of the models. So the mental health coordinator, along with working with the family, also monitors the therapist's documentation. Their documentation has to align with the therapy intervention model, with kind of payment for the therapy intervention model being quite an incentive to ensure therapists are using fidelity to the model. And then usually a lot of times it just is when therapists aren't following the model, they need additional resources, they need a booster session and reminders of what the expectations are within the model. The Connections program also provides consultations to therapists free of charge when a new model has been provided to them. For example, I believe it was about a year and a half ago, Connections trained 10 therapists in an expressive arts model and then provided a year's worth of monthly consultations for free to ensure they feel confident utilizing the model and following the fidelity of the model. There is definitely a potential for fidelity drift. So a lot of therapists may have a group of kiddos who all experienced the loss of a loved one. Maybe that would be through incarceration, death, deportation. So the therapist will sometimes, adjust the curriculum to talk a little bit more about grief and loss as compared to something else, just to really serve the needs of the clients. So although it's a good thing and the therapists are using their clinical judgment, it is a little bit of drift from the initial therapy intervention model. My overall opinion or perception of the Connections program is I think it's an amazing program. I think it would change a lot of lives for children and families. I think it's long overdue that we as a society work to prevent families from entering the juvenile justice or child welfare system. And I think it's overdue that we make mental health services accessible to everyone, especially people who have experienced trauma. I guess my one recommendation or kind of concern that I noticed was a lot of therapy, specifically, I guess group and individual both, a lot of the therapy sessions were happening in the school setting. So I was just a little concerned with the level of parent engagement or involvement and how parents would be educated on the child's coping skills, therapy plan, just utilizing those goals in the home and in the school when the parent isn't present for any of the sessions. That was kind of my main concern. So I guess I would strongly encourage more parent involvement and engagement. I think when assessing this program, I think the most effective measure would be through quantitative design. I think especially looking at this on a case-by-case basis, there's many external factors that may impact whether this program positively impacted the family, but to see overall everyone in the Connections program, if juvenile justice was prevented, CPS involvement was prevented, substance use, graduating high school, I think it would be really interesting to compare a group of kids who don't have Connections as an opportunity in a city similar to Omaha and just see compare the data of whether or not Connections was effective in that way, and really just to see the number and the percentage of people who were able to avoid those certain negative systems or mental health concerns through the Connections program would be very interesting, and I think would be most effective for more funding or more charitable donations towards this cause. And last but not least, I just wanted to give a little bit of some Connections information. As social workers in the community, I'm sure everyone will come across children or families that may be struggling or may be appropriate for this program. So here in this slide, I do have the referral number the family can contact Connections with, the email they can contact with if that's something they're more comfortable with. And then I also included the Connections website if there was any more information you would like to learn about the Connections program. Thanks so much for taking the time to watch my video and learn more about the Connections program. I really appreciate it and hope you have a great rest of your day.